Welcome. Today we're going to talk about the street outreach component of a homeless crisis response system. We will look at what street outreach is, primary and additional services in a street outreach program, who is served by street outreach, and why it's important to provide it. So, what is street outreach? Street outreach serves unsheltered households by going to where they live instead of waiting or expecting them to come to agency locations. Street outreach requires building relationships and trust with unsheltered households since you, as a street outreach worker, are approaching them. Unsheltered households should feel comfortable and safe with street outreach staff. The purpose of street outreach is to engage unsheltered households to provide immediate support, intervention, and connections with homeless assistance projects and/or mainstream social services and housing programs that can connect households to permanent housing. The most basic components of street outreach are engagement and case management. Through engagement, street outreach workers build relationships with unsheltered people where they live and connect them with services that can help them secure permanent housing. Case management takes engagement a step further by maintaining an ongoing relationship with the unsheltered household until they are housed or no longer want services, and working with this household to assess, arrange, coordinate, and monitor service delivery to meet their needs. Engagement and case management should always be offered hand in hand, as case management strives for a holistic approach to supporting a person to permanent housing. Additional services that could be offered but are not required parts of street outreach include emergency medical and mental health outpatient services. These services are offered by a licensed medical or mental health professional on site where an unsheltered person lives. A street outreach program may also provide access to basic needs, including identification, healthcare services, mainstream benefit enrollments, food, clothes, hygiene items, and more. Who is served by street outreach programs? Street outreach services should be offered to any unsheltered household who is unable or unwilling to access emergency shelter housing or appropriate health facility. As mentioned before, street outreach involves going to where unsheltered people are and not requiring them to go to an agency site to receive services. For many reasons, unsheltered homeless individuals do not go to homeless service providers to receive services, and often there are not enough beds in shelters to house all households experiencing homelessness, so it's critical to go where they are living. Without street outreach, it would be more difficult to serve all community members experiencing homelessness. If you'd like to learn more about street outreach or have any questions, you can email THN at esg@thn.org. Thank you for listening.